Welcome to Open BXRx on BronxNet. I'm your host, Sonyi Lopez, inviting you to get social with us at BronxNet TV on Instagram and Twitter and BronxNet Community Television on Facebook. Doctors and scientists in the United States and Europe have called a multi-inflammatory syndrome, or MIS-C, pediatric illness that appears linked to COVID-19 deeply concerning. Also, what is Kawasaki disease? What are the symptoms, and how are these illnesses linked to coronavirus? Joining us now to discuss are Dr. Peter Sherman, Dr. Murli Purswani, and Dr. Tanya Rogo of BronxCare Health System. Doctors, thank you so much for joining us today.
Thank you for having us.
The first thing I want to learn about is about the Department of Pediatrics over at BronxCare Health System. Can you tell us about it, Dr. Sherman?
Okay, so we are Department of Pediatrics at BronxCare. Our main offices are right off the Grand Concourse, 1650. We are a comprehensive pediatric department. We have a 20-bed inpatient unit, a 5-bed PICU, a neonatal intensive care unit, a well baby nursery, and we have 4 clinical sites through the Bronx where we do general pediatrics, adolescent medicine, and specialty medicine. In addition, the hospital has a separate pediatric emergency room. So pretty comprehensive service of pediatrics, including not only medical services through pediatrics, but we have other departments. We have a pediatric surgeons who come here. We have specialists like in dermatology, in allergy. We have a fairly big psychiatric department that has a psychiatric pediatric emergency room and does a lot of child psychiatric health. So a full range of services, and we are treat the community that surrounds us too. And I've been here since I think like 1890.
Ooh, thank you, Dr. Sherman. And for Dr. Rogo or Dr. Purswani, whichever one of you can tackle this, many parents are worried about this disease, the Kawasaki disease. What is it, and what are the symptoms that parents should be watching out for in regards to their children?
So Kawasaki disease is a disease that causes an acute illness in children usually under the age of 10. And if untreated, can affect the coronary arteries, which are the blood vessels that feed the heart. And the symptoms of Kawasaki, in addition to the fever, they can have red eyes or bloodshot eyes, red swollen lips, red tongue, swollen lymph nodes in the neck, and rash and swollen hands and feet.
How is this disease related to COVID-19?
So there were reports that initially came out of the United Kingdom and since then have been reported in New York and other parts of the world of children who have a disease that looks like Kawasaki, so it's Kawasaki-like, who either tested positive for COVID-19 with like having an active infection or showed evidence of having had a past infection of COVID-19. It's still unclear yet how COVID-19 is related to Kawasaki or this Kawasaki-like illness. That's something that we still don't know.
Got it. Thank you, Dr. Rogo. Can we also learn about the new multi-inflammatory syndrome in children? What is that? And as per the CDC's health advisory?
So the MIS-C, or multi-system inflammatory syndrome in children, is an inflammatory condition in which several systems of the body are affected. So it can affect the heart, the lungs, the kidneys, the brain, which is why it's called multi-system. And it seems to cause this widespread inflammation. And some of these children can develop shock, can develop problems with their heart. It appears that most, if not all of these children show evidence of having been infected with COVID-19. And so we think that it is something that is post-infectious, meaning that you have the infection and then for some reason the inflammation that's sparked off in the body doesn't get turned off and causes inflammation in different parts of the body. It's a brand new thing that we're seeing. So, we're still studying it and trying to describe what it is. We still don't know a lot about it.
Got it. And Dr. Purswani, to have you chime in here, what can be done to prevent the transmission of both of these? I understand that this is still being researched, but since it is, as Dr. Rogo said, related some way to COVID-19, how can we avoid this from hurting our children?
So first of all, thank you, Sonyi and Franchesca, for having all 3 of us on board. We appreciate this opportunity to talk about this disease. For us to emphasize that to prevent yourself from getting COVID-19, you should do everything that pretty much we are all hearing about in the news every day. You should wear a mask. The mask not only protects you from getting it, but even more important, it protects others from getting it from you. We know that many people can shed this virus and be asymptomatic, so you don't know that you are shedding it. Putting the mask on will protect you and others. Staying more than 6 feet from people is also protective. You know, for young children, staying at home and not going out unnecessarily is very important. And for young children, wearing a mask is important. But when they are too little, you have to be careful about applying a mask on them. And I think perhaps if we have time, we can talk more about that later.
Yes, absolutely. I actually wanted to lead up with that question. Should children also be wearing masks during COVID-19? A lot of parents are concerned that that might stop the airflow from a small child. What are the regulations when it comes to that?
I can talk about that. So we recommend masks for children 2 years of age and older. It's not safe to put a mask on a child less than 2 years of age, because it can block their breathing and they can actually suffocate too. So it can be a challenge getting a child to wear a mask. It can be uncomfortable, especially now in the hot weather. So you might want to try to get a cool mask, something like maybe with an animal face. If children see that everyone else in the family are wearing a mask, that might help them go along with it. Maybe start having them wear the mask in the house. But as Dr. Purswani said, we want children staying at home. And the thing I have to say is that most children who catch the COVID-19 virus either do not know they have it because they don't have any symptoms, or they have very, very mild symptoms. So it's very unusual for a child to get, it's not more than usual, it's rare for a child to get seriously ill from getting the virus too. So parents need to be reassured about that and also reassure their children. It's more likely, and what's much more important, is that a child may have the illness, not know it, go and give grandma who's 85 with diabetes and hypertension a kiss, and pass on the infection to that person who is at much more risk of getting seriously ill and even dying too. And even when we talk about the MIS-C syndrome, it's still a relatively rare phenomenon as far as we know, meaning it doesn't happen in children that often. There's probably thousands upon thousands of children who've had COVID, we don't even know. And the number of children that have gotten the MIS-C is under 200. That's the latest figure I saw. I don't know if Dr. Rogo or Dr. Purswani saw anything less. So it's really, really important for parents, first of all, for parents not to be terrified about this. It's unusual, it's rare, and also to really reassure their children that, you know, it would be very unusual for them to really get sick from getting this illness.
Thank you, Dr. Sherman. I wanted to ask about the challenges you're facing over there at the BronxCare Health System in the pediatric department. Have there been a surge of cases coming in, parents coming in with any of these issues, the Kawasaki disease? Is there a surge nowadays there?
So we haven't had quite the size of surge that the adults have had. The adults have been really overwhelmed and slammed with a lot of patients coming in. But we've had a fair amount of children coming in, yes, and they come in with fevers. And because of all the discussion about MIS-C, our emergency room doctors are very concerned and very vigilant in trying to pick up this disease. The volume isn't as high as the adult volume, but there has been an uptick in calls from the emergency room about how to manage this disease.
Right. Got it. And what should parents do if they fear their child has it? Of course, go to the doctor. But are there any measures that they can do, Dr. Rogo or Dr. Sherman, that you can address?
Okay. So if parents have a child with fever and a rash or red eyes or any of their symptoms that seem consistent with MIS-C or Kawasaki disease, they definitely should take their child in to seek medical attention so that they can get examined and evaluated. And in general, also, if they just are concerned that the child may have COVID-19, so fever, cough, in children, we also see abdominal pain and diarrhea as well. So if they have any of those concerns, to just seek medical attention. Testing has become more available now, and the Department of Health has a phone number that you can call if you have if you need help in terms of finding a place where you can have your child tested. You can call the Department of Health, and they'll set you up an appointment at a particular testing location.
Got it. And for parents with other concerns that are afraid to bring their child to the hospital at this time or to the doctor at this time, what can each of you say to those parents?
Well, one thing I want to say too is if your child is not seriously ill, you have alternatives. A lot of doctors' practices are opening up at this point, and they're doing telehealth too. So they're able to talk with you over the phone and decide, you know, is this something where your child can stay at home? And also they can, more and more people are starting to do the testing, as Dr. Rogo said, so you could be referred to a testing site or even be tested in a doctor's office. But it's really important. We want to, you know, this is not over by any means. And I think our greatest fear is that people will think it's mainly gone and we don't have to be as careful. So if you're going to go to your doctor's office, we want you to call ahead of time so you can tell them that, you know, if they decide they want to, that you need to be seen, that they can do it in a safe manner too. And they're, you know, what they'll do is they might have the child wait in the car, wait outside until they're called in, and then not go through the main waiting room, put on a mask if they're old enough too.
Thank you so much, doctors, for your time today. I wish we had more time to speak about more things, but we'll, of course, invite you again. Now we have this relationship with each other where we can speak about children and pediatrics on BronxNet.
And we'd be happy to talk with you guys again, and we're very proud of the care that we provide here.
Thank you, Dr.
Yes,
Rogo.
thank you
Dr.
very much. And remember, hand washing and face mask, remember.
Thank you again, Dr. Rogo, Dr. Sherman, and Dr. Purswani from BronxCare Health System for your time today. Open BXRx, we'll be right back.